Welcome to the 5 on 5. Joining us today is Dr. Jenny Mladenovic, the Executive Vice President and Provost at Oregon Health and Science University. Dr. Mladenovic, thank you so much for being here today.
Thanks for inviting me.
So for those who aren't familiar with what OHSU is, talk to us a little bit about what it is.
Sure. So OHSU stands for Oregon Health and Science University, and it is actually Oregon's only academic health center. And when we talk about an academic health center, we mean our professional schools like our School of Medicine, School of Dentistry, School of Nursing, School of Public Health now, right, and our School of Pharmacy, and a hospital. And we're aligned with the hospital so we can practice what we teach and teach what we practice. And that's what allows us to conduct also cutting-edge research that actually improves the lives of patients.
Incredible. Now, you're based out of Portland, but you're here in the Rogue Valley. Talk to us about what's brought you to Medford.
Oh, of course. Well, OHSU does consider Oregon its 96,000-mile campus. So we actually are very dependent on the state and see the state as amazing resources, both for us and to serve the state. So in Southern Oregon today, we are meeting with some friends and supporters of our new Rude Family Health Pavilion. And this is a pavilion that we are building in Portland to serve those patients who come to us from throughout the state and beyond. Many patients actually have critical, long-standing chronic diseases like our patients with leukemia or other cancer, and they actually need to be treated in Portland and so need a place to stay. So you might have heard of Ronald McDonald. So part of our Rude Family Pavilion is will be managed by Ronald McDonald, but the other part it will be managed by us for our other patients. So in fact, it's a 5-story pavilion that will really allow improved access for many patients throughout the state.
It's tough to have to travel for care like that and not have somewhere to stay. So this is really going to allow people a place to be there, especially if they have multiple appointments over multiple days.
Absolutely, and it'll be a beautiful resource for our patients that should create much more of a home feeling while they're undergoing their care.
Now we have much more to talk about, including a partnership that is launching in Klamath Falls, but we're going to take a quick break. We'll be right back. Welcome back. Joining us once again is Dr. Jenny Mladenovic, the Executive Vice President and Provost at Oregon Health and Science University. Again, thank you so much for being here.
Thanks.
We talked a little bit about what brought you to the Rogue Valley. We are understanding that there's a nursing campus in Klamath Falls. Talk to us a little bit about what that is.
Sure. Well, actually, our School of Nursing trains the majority of nurses throughout the state through a number of campuses. 2 of those campuses are in Ashland, one's in Ashland and the other one's in Klamath Falls. But we also have one at Western and one at Eastern. So those have been long-standing partners, and they actually are great opportunities for our nurses to train where they might potentially work, but also be exposed to the wonderful faculty and a curriculum that is exactly the same throughout the state. So that is a long-standing partnership, and it is critical to training our workforce. In Klamath Falls, however, we've had a long-standing partnership, not just around our nursing program, but with Oregon Institute of Technology around a laboratory and an EMT program, and additionally, and most importantly probably, around a family medicine training program, where several of the residents also come to Asante here in Medford. This training program is really unique because it trains family medicine practitioners that stay in the rural community, and over 80% of the trainees that graduate from this program end up in a rural community. Quite a success. Wow. So because we have so much success in Klamath Falls, we began to say, well, how can we leverage this opportunity to expose all of our students at OHSU, which is about 600 students a year, wow, to rural communities? They need to understand that rural health is different from practicing healthcare in a city.
Okay.
And so that's the gist of why we began to think about how could we do this differently. So what is very different about a campus in this regard is that Klamath Falls is the seat of the campus, and it depends on lots of community partnerships and Klamath Falls, which I'll talk about in a moment.
Yeah.
But it is also part of a statewide approach to creating better health care for rural communities, but also learning from those communities about how to do that. So it's really important to the workforce of the future that they understand that rural health is different.
Interesting. And speaking of Klamath Falls, you recently announced a partnership with Sky Lakes Medical Center. What is that?
So Sky Lakes has been our partner for a long time in our family medicine training program, and most recently as part of this rural campus, since we'll be training many more students, and it'll be interprofessional, which is very different. So it's not just medical students or nursing students, it's dental, pharmacy, PA students, and our public health students. We began to think differently about how we would care for patients together. And Sky Lakes has been a long-standing partner, and they've really just partnered with us to build a new interprofessional building, half of which will be committed to direct patient care through our faculty and our residents and our students, but the other half will be dedicated to new methods of education. So we're very excited about that.
Wow, I can imagine. Now, Dr. Mladenovic, is there anything that I didn't touch on that you want to add while we've got you here?
Well, I would like to kind of talk a little bit about the concept of rural health, which is that we think that that your zip code shouldn't determine the quality of your health care, rather, but just how you get it. So through this rural campus, we're not just educating or providing clinical care, we're also partnering with the community to figure out how to deliver care better and new ways, including new technology to deliver health care. So that's the whole concept of this new interprofessional campus around rural health.
Excellent. Well, thank you so much for being here, Dr. Mladenovic. We really appreciate having you here in studio.
Thanks for inviting me.
We'll be right back.